Hi, I'm Marcia Snow. I'm a speech language pathologist with health-related home care. And today I'd like to talk to you about communicating better with older people. Communicating with older people often requires extra time and patience because of physical, psychological, and social changes of normal aging. Even more effort is needed in nursing homes where 60 to 90% of the residents may actually have communication disabilities, and at least 21% of all older adults have both hearing and vision loss. Some tips for family members and caregivers to make communicating easier with older people include: approach a person and make sure they see you, then announce yourself to avoid startling them. If you know they're hearing impaired in one ear, approach them on the other side of their ear that they can hear better with, but just don't startle them. Reduce background noises that might be distracting. For instance, turn off the radio, turn off the TV, close the door if it's noisy outside the room, or move to a quieter place. If you're eating out in a restaurant, it's important to stay away from the front door, stay away from the kitchen door, the ice machine, things that might add background noise so that they can better hear you. You should always face the person and make sure that your face is well lit and easy to see. So, for instance, when you go into a room, a restaurant again is a good example, find the place that's most well lit so that they can see your face. If the patient or the person has a hearing aid, make sure that they're wearing it, that the battery's working, and that it's in the ear properly, and that it's turned on. If you're in a nursing facility and you're not sure how to put them in or how to check them, and the person seems to be having trouble understanding you, ask the nurse to check their hearing aid. When you talk to them, it's important to use natural volume, normal information, and normal gestures. Don't exaggerate. Oftentimes it's just confusing to them and it makes it more difficult for them to understand what you're saying. Encourage them also to wear their glasses if they have them, and please make sure they're clean. If they're not, take a minute to go to the sink and wash them. It can make a big difference. Talk about familiar subjects, like their family members, special interests of the person. Present one idea at a time and avoid quick shifts from topic to topic, because sometimes it takes them a few minutes to process the information that you're saying. Use familiar vocabulary and use short sentences. Allow them time to reminisce. Memories are very important. Don't hurry them. Give them time to respond, and please don't be afraid of moments of silence. As I said earlier, sometimes they need a minute to process what you're saying. Sometimes they might be trying to put into words what they want to say to you, and you might miss something very special if you try to talk too soon and don't allow them that time. Ask yes/no questions or provide choices instead of open-ended questions. For example, would you like coffee or tea instead of what do you want to drink? Don't expect a person with dementia to remember information, and avoid arguing or correcting their faulty memories. If they're remembering something and that's how they remember it, just go with it. If you correct it, they won't understand. Be a good listener. If you're having trouble understanding them, look for hints. Watch their eye gaze, see what they look at to give you a hint of maybe what they're talking about. Watch their gestures. They might be giving you clues with their gestures. And take a guess. Are you talking about the game? Yes? Okay, tell me more about it. I didn't get to see it. Of utmost importance, avoid condescension. It's very important when communicating with elders and with those with dementia and Alzheimer's disease to avoid this style of condescending speech. This is characterized by a slower rate, exaggerated intonation, elevated pitch and volume, and the use of very simple vocabulary and grammar that you might not normally use. They can pick up on that. Frequently described as like a sing-songy voice pattern, or how you would speak to a child. We may feel like these changes show warmth and that we're trying to help communicate with them, but in fact, elders perceive them negatively and will eventually withdraw and may even decline altogether. I hope this has been informative to you and helpful. If you have further questions, please feel free to contact any of the speech language pathologists at Health Related Home Care or at the American Speech Language Association at www.asha.org.